Welcome to the New Jersey Morning Show. I'm Dina Delisa Gonser. Recent research has shown that, contrary to what was long believed, all races do not have the same risk factors for self-harm. The New York Times had a story about how self-reported suicide attempts rose nearly 80% among Black teens from 1991 to 2019, while attempts did not change significantly among those of other races and ethnicities. One study of high school students published in September found that the Black teenagers surveyed were more likely than white teenagers to have attempted suicide without first having suicidal thoughts or plans. Here to help us understand all of this is Dr. Ulrick Vieux, Chief of Child and Adolescent Psychiatry and Director of Child and Adolescent Psychiatry Education and Training at Hackensack University Medical Center. Welcome, Doctor.
Good morning. Thank you.
Yes, thank you so much for being here and for discussing these important topics with us.
Most-
Um, so, to start off, is there a stigma about mental health and seeking treatment among African Americans? And if so, does it differ from other groups?
Well, first of all, I would say that the stigma exists amongst all
Mm,
groups. And I think that understanding mental health is a challenge that all medical professions have to adequately address. With that said, I am very hopeful that the medical field is actually starting to address these aspects. So, for example, if you look at sports, people are
mm,
starting to acknowledge the role that mental health plays in making sure that athletes reach the zenith of their potential. And we need to also make sure that we are doing the same outreach towards communities of color.
So, how do social determinants of health impact mental health?
Well, I think one of the biggest things that we have to address and to actually acknowledge is that at first, due to the stigma of mental health, it can lead to people not feeling comfortable speaking to
Mhm.
providers, one, and number two, actually having access to providers that understand the cultural nuance that certain communities may present. So I think that's one of the things that we are challenging with. Now, I will say that one of the struggles that we have within the Black community is that only 2% of psychiatrists
Mm.
are Black. And
Wow.
that says the same thing for psychologists and social workers. So we have a serious dearth of actually
Hmm.
mental health professionals with that come from these communities. With
Wow.
that said, as an educator, I do believe that all groups can adequately treat all communities with the necessary skill set.
Hmm.
But as educators, we have to be able to at least acknowledge that and address the problem effectively.
Those are really huge statistics there. And so, Dr. View, research shows African Americans are 50% less likely than their white counterparts to receive mental health treatment. Why is that?
Well, first and foremost, this is where, as mental health providers, as psychiatrists, we have to take ownership
Hmm.
at the historical reality. Case example, Um, there was a disorder called drapetomania in the South in the early 1900s, in which an African American person that was enslaved, if they ran away from their slavery, they would be
Hmm.
diagnosed as having a mental illness. You look at the Abraham Flexner report in 1910 that subsequently wound up closing a lot of African American medical schools. They had a profound impact in the number of providers of color from a generational perspective. So these are some of the things that we have to deal with. In addition to that, if you look at the Black community as all communities in America, it's very nuanced. So yes, we also have a very large immigrant population, whether from the Caribbean, whether from the continent of Africa, and all of these issues of trying to navigate what it means to be an American can actually add to stress.
For sure. And these are definitely complex issues. But for somebody who is watching in the African American community right now that may be feeling like they're in distress, what would you want them to know? How would you want them to take that first step, and why is it important?
Perfect example. So one of the things that we also have to understand and respect the reality of being able to work with key community stakeholders. So, for example, some prominent Black psychiatrists who are involved in research have actually reached out to Black churches, Black mosques, actually getting the spiritual community involved because if you have that connection with people that have a lot of respect within the community, that can actually help destigmatize mental illness. In addition to that, if you're reaching out to the communities, whether it's the churches, whether it's the barbershops, they can help delineate what is normal or healthy adjustment behavior, adjustment
Hmm.
struggles, as compared to something that may be a little bit more pathological, that may need more of a help from a trained professional. So I think that's one of the things that we have to do is actually reaching out to the community in much
Hmm.
more effective and meaningful ways.
Okay. And as an individual, where can somebody reach out? Where would you suggest they start first if they're looking for whether it is a mental health professional or a community based service that can come alongside them?
Well, first of all, first and foremost, we have to acknowledge the vital role that our primary care providers
Okay.
play. So,
Hmm.
for example, at Hackensack University Medical Center, one of the things that I love about our institution is that we really truly believe in integrative collaborative care. So, for example, I'm very close with our pediatricians. So, oftentimes, our pediatricians will be the first line of of therapy, of actually identifying problems. So, for example, so one of the things that we will do, working with consultations with our pediatricians, the pediatrician may start a medication on a patient, and we may actually help consult
Hmm.
the pediatrician regarding that aspect. So that's from a child and adolescent perspective. From the adult perspective, being close with your primary care provider. I think that's really important. And this is where, as I said before, the importance of understanding integrative care, understanding that mental health is a part of complete holistic care is really an important step that we need to take. And again, also bringing in key stakeholders within the community, whether it's your faith community, whether
Hmm.
it's fraternities and sororities, whether it's talking to your local PTA. I mean, that's something that our department does a lot. We do a lot of presentations within our local school district. Basically, being
Hmm.
present in the community at large.
Thank you so much, Dr. View, for all of your work and for these action steps that I hope our viewers take into account as they are going along on their mental health journey. And Dr. View, thank you so much for coming on and sharing your expertise. We value it so much so.
Thank you so much.
There's more New Jersey Morning Show online. Watch on demand on our website, ONNJ.com, or on your Roku or Fire TV.